It's a beautiful Thursday in Burlington, Vermont, one of the safest states in the nation. And we are I'm really extremely proud of that. I'm proud of that. I've been telling my folks in Missouri that I'm safe now. So I also told them that other than they want to visit, they just need to make sure they let me know so we can get them tested. But it's all good. We are joined this evening by Dr. Mark Levin, Commissioner of Vermont's Department of Health, the leading medical expert for the state of Vermont, who has worked diligently for as long as I have known him to make sure that we keep this state safe and secure and the people of Vermont in good hands. He's joined us tonight. It's good to have you here, Dr. Levin. Also, we have with us Dr. Tim Whalens, the Chief of Division of Child and Adolescent Psychiatry at Mass General Hospital and a professor at Harvard Medical School. And most importantly to us, he is the parent of 2 Champlain students. He's also joined us from Boston tonight. Tim, thank you for being here. Also joining us, we have, of course, Leslie Averill, the Chief Operating Officer and Vice President for Academic Affairs. We also have Catherine Barrow. Catherine is, as you know, the Chief of Staff, but also a co-leader with Kerry Sleeper on our return to campus planning and initiative. I can't say thank you enough to those 2 individuals for the work that they've done in moving us forward. And also with us is Jennifer Nichols, and Jennifer also been doing yeoman's work in getting us prepared for return to the fall. You know, the reason that I asked to bring these 2 experts together tonight is because I want to be able to convene a no-holds-barred conversation about the most important aspects of our return to fall, which is the health and the welfare of our students, faculty, and staff. I have said consistently that is the most important and the most critical aspect of our return. And that if we do a good job with that, and then everything else will fall into place. And so I've invited our guests tonight to answer any questions that you may have regarding the medical science behind reopening. And I believe that the fact remains that we are basing our decision on the guidance of Vermont Medical Director, the state government, and also CDC. So, you know, I see this as a unique opportunity for our Champlain community to ask the most respected subject matter experts in the state and a parent that also is a subject matter expert, unbiased perspective, and to ask those questions, to engage, so that you can be more informed, and that we can prepare for a very important start in a couple of weeks. And I say this, I believe that faculty, teachers, and professors are the new frontline workers in America today. And as we transition into the fall semester, these frontline workers must be prepared, must be protected, must be aware, and must be vigilant in that process, because clearly to us, your health and welfare is very important to us. And so with that, I'm going to hand over to Catherine, and she's going to facilitate this conversation this evening. Catherine?
President Conde. So we're going to go to Dr. Levin. He'll be with us for the first part of the program, and so we'd like him to offer a few comments, and we can do some questions, as well as Dr. Whalens. We're going to try to focus our questions tonight on things that our medical experts can answer. We know there might be some Champlain specific ones that connect to topics that come up tonight, and we'll try to get to some of those too. I'll just turn it over to Dr. Levin. Thanks for being here.
Yes, thank you very much, Catherine. I want to say hello to everybody. It is a glorious night in Burlington, Vermont. My office here in Cherry Street actually looks out on the Adirondacks and the lake. Might even have a nice sunset tonight. I am delighted to speak with the Champlain community. A number of you, past or present, have been patients of mine actually when I was practicing general internal medicine before this job. So hello to those who recognize me in that way. This has been a tremendous collaborative effort between the Department of Health and literally every campus in the state of Vermont, along with numerous others in state government, and other specialists in various fields of medicine and public health. And I have literally been meeting with every student health center since I think late March, April at the latest, on a weekly basis. And Annika from your school has been a prominent member of those meetings. And long before we even thought there was a remote chance of reopening colleges, we were problem solving literally on every aspect of life in the era of COVID. And there were students, both international and some local, who were on campus still at Champlain. And there were problems to solve around that. But there were just numerous issues to think about in a proactive mode, because this whole crisis and pandemic has been trying to stay one step ahead of things, knowing the science, trying to understand where we're going, what could happen, and anticipate that in advance. And hopefully be very preventive oriented and not get to any of the endpoints that we might fear. And let me pick up on the word fear, because I think that's an important one. I know we have a specialist in mental health waiting in the wings, but at the same time, if there's one thing I recognize in people and in the state, and clearly in the education community, from childcare through kindergarten through college, it is anxiety levels and at times appropriate fear. And we just got to call it what it is and put it on the table. I have no question that someone is fearful of coming back to a lecture hall, to a seminar room, to an interaction with a student. And we need to sort of put those fears out and sort of say, which ones are truly appropriate? How can we mitigate them? Which ones might be actually a little far-fetched and we can be reassuring, but never be just falsely reassuring and blow anything off, because the reality is everyone is living with this in every sector of our society, whether you're working in the supermarket as an essential worker and much more contact with the public than most of us actually would have thought we should be. All the way up to a professor in a college or university, or to a healthcare worker who suddenly re-entered the exam room, re-entered the operating room, the hospital. It's on everybody's mind and we need to acknowledge it. And if we can actually do things that would reduce anxiety and improve outcomes in a very honest, candid way, we ought to let people know about that. They can still make their own decisions, but we can at least hopefully show them the science behind what we're doing and thinking and why we think it's a reasonable course of action for someone to take. So we've been involved in these discussions, like I said, for a long time, and then much more recently, when it really became evident that, yes, indeed, colleges and universities in Vermont were going to think about reopening, we spent a lot of time focusing on all of the issues that surround that. I've said this many times, there's literally no other state in the country that is as well poised to do this as Vermont in terms of where Vermont stands now in relation to the virus. You know, we have the lowest percent positivity rate of our tests, less than 1%. We have very low incidence rates, new cases per day. We are in a really, really good position. So if we can't do this well, I shudder to think if anyone can. whether it's, again, kindergarten, high school, or college. So the timing is definitely right. Without speaking with any partisan tongue, there's a lot of insanity throughout the rest of the country. There are states that have positivity rates of 30% that are playing tackle football in their high schools, attending as spectators to those events, and on the verge of opening their schools. What can I say? You know, if I were anything in that state, teacher or otherwise, I would be petrified. But that is not Vermont today. And we hope it is not Vermont tomorrow or next month either. And we have to just keep that perspective in mind. The goal of suppressing the virus has occurred here, and we want it to continue, but we have to acknowledge that it's happened. Having said that, you still need to devise opening any sector with safety as the =1 ingredient. We've come out with a document about opening colleges and opening schools for that matter too. We've relied on CDC, which provides a lot of information, but I have to be honest, CDC is often very general and doesn't get specific enough for people to feel comfortable. We've gone to that level of specificity to really try to help people understand that we're thinking about every nuance, not just the general ideas about hygiene and spacing and things of that sort. And we need to just acknowledge that. So what we've come up with is the notion, because Vermont is, you know, we want to be so protective of Vermont and of ourselves and our own health, we understand that if there's a danger, it's beyond our borders. Not that everyone else is evil or we should be suspicious or paranoid, but generally, if they're not coming from the immediate region, they're not in what we call a green zone, and they may be in a yellow or a red zone. And we've seen over recent 1 month that there's an increase in those yellow and red zones, and actually less people eligible to come to Vermont to vacation without quarantining first. So we're very aware of this and watching this very closely. But for the purpose of college students coming to Vermont, the assumption is really everybody's in a red zone. Everybody could be vectoring disease here. And how do we mitigate that? How do we make sure that when the campus opens, everyone on that campus feels that it's a safe campus? And even more so in a campus that opens in a city where there's a blurring of the distinction between college and city. You want to know that your city is doing as well, and the city wants to know the college is doing as well. So that's a very collaborative effort right there. And we work very closely with Burlington. So every student coming into town is going to have a quarantine protocol that they have to fulfill. Every student coming to town is going to have to be tested as they arrive and tested 7 days later. And these are just the way things go. That is the way we have written everything out. So we're doing as much to make sure that we have a foundation, if you will, of understanding of what disease might be present or not present, and so in a so-called pretty clean campus when day one comes, because we've done the proper work of identifying anybody who might test positive. And even if they haven't tested positive, we've quarantined them for this period of time that would be required so that they shouldn't be able to transmit infection to anybody else. So that's right out from the start, which is a pretty aggressive strategy. Not that other states or colleges aren't doing it, but many aren't. We are, and we're making sure that people will adhere to that. And then, you know, I'm not going to go into all these nuances of what's written in the rules, so to speak, and in the guidance, but there's a lot of stuff in there about hygiene and proper cleaning, etc., of surfaces and rooms and you name it. There's a lot in there that has to do with the core principle of physical distancing. And you're not going to be in a lecture hall with the usual cohort of people in a lecture hall, obviously. It's going to be more like the discussion group size is in the lecture hall. And the lecture might be actually online. This goes for the students' living arrangements as well, trying to make sure that we're keeping as much opportunity to have students be apart and not crammed together. The other principle, of course, is facial covering, which is sort of a universal rule now in Vermont anyways, but that's a key part of disease mitigation strategy that will happen on the college campus as well. So all that's kind of already been thought about. The mass gathering issues about, you know, having large groups of people like in a cafeteria all sitting together, obviously that's not going to be happening. So there's a lot of guidance on that level as well. I'd like to think we've thought of most of the things we need to think about, but the reality is we still meet weekly, all the colleges in Vermont, including Champlain, and we literally address 20 questions each time we meet because questions keep coming up. And as we need to, or if we need to refine the guidance, we do that pretty much on the spot. So it's an evolving picture, needless to say. Nobody's done this before, unless you were alive in 1918 and remember it. This is a pandemic, and this is the way we respond to it. So a lot has gone on there. We've also gotten a lot of questions from people who are in the staff or faculty levels at all levels of education. And, you know, the healthcare sector is obviously part of the advising community to let people know for their own individual situation, is returning to a classroom, is returning to a campus, what have you, a good idea for you from a safety standpoint and a health standpoint. We know there are higher risk groups. We also know that there are plenty of people that have very minimal risk. But in the end, every risk equation is really that person's risk equation and should be discussed very proactively with a healthcare provider to be sure that everybody's on the same page and you're getting proper advice. So I could go on, Catherine, and I want to just make sure I'm saying as much as you'd want me to say and allow the rest for questions. Or if I've left something out important, please let me know. But just keep in mind the theme is providing a lot of guidance, the majority of it based on pretty good data and good science, and a very collaborative effort that's been going on long-standing amongst all of the colleges in Vermont, as well as very individual efforts, such as myself and your president, having talked a number of times, even before he arrived in town to take over the job. So I'll leave it there unless you tell me I missed something.
No, that's great, Dr. Levine. Thank you very much. Before we go to Dr. Willens, because I know we don't have you for the full hour, Dr. Levine, there's a few Vermont specific questions that have come in that I'd like to ask you to take if you don't mind. And to my colleagues, I'm going to consolidate some questions in the name of efficiency. We have some similar questions coming in. Dr. Levine, could you speak to sort of some of the metrics that the state and the college would be tracking over the course of the fall that could impact a decision to change course in our operations, and sort of what are the conditions that you would be looking at to advise the colleges about any decisions?
Yeah, so this is a question really on two levels, because you could have potentially an outbreak just within a college, or there can be what's going on across the state. So within a college, clearly, the public health department is partnered with the health apparatus at the college. So any positive test result we will be aware of. We've already agreed to help with more extensive testing if that's needed by the college. pop-up kind of arrangement. And there's the ability to do contact tracing that is our skill set in public health and can be done very readily as part of the normal contact tracing we were doing in all communities. This is just the college community. So that's one level of things. And if there needed to be a determination about what to do in the college because of the extent of the number of cases, we would work closely with the administrative staff at the college and provide our counsel and advice regarding that, just like if it was a public school or an elementary school. With regard to the state metrics, there's really a list of 6 metrics that we're following continuously, and we report on these every Friday at our press conference. They include the numbers of new cases, the rate of increase in growth of the new cases, the percent positivity rate of tests across the state, our ICU and hospital utilization, and if they're getting to any warning levels, things of that sort. Something called syndromic surveillance, which means what are urgent care centers and emergency rooms seeing in terms of people complaining about symptoms that are potentially COVID-19 symptoms? Is that increasing? The same kind of surveillance we do when it's flu season and we ask about flu symptoms. So all those things we track, and basically we integrate them all together and come to decisions about, can we continue on the course we're on, or do we need to make some alterations? For instance, something you might do early on if you were concerned about the trend of numbers, you would be doing something to prevent people from being so close together in environments that foster the spread of disease. The one that stands out is the bar. So, bars would be quickly an early action point, if you will. You might take congregate group arrangements where we're allowing 75 people to be indoors in a building and say, no more, it's down to 25 or 10 or what have you. So we would integrate all this information and come to those kinds of public health decisions that try to work against the virus. The virus is capitalizing always on people in close contact, breathing the air that they all share and infecting each other. And we want to try to mitigate against that. So hopefully that answers the question well.
Thank you. One more question, Vermont specific. As the Department of Health continues its contact tracing efforts, what are you learning from that process about any patterns related to how individuals are coming into contact with coronavirus?
Yeah, so what we've learned is that actually household clusters are relatively common. Originally we thought, boy, looks like sometimes households are protected, like one person's infected, everybody else is doing well. Well, turns out with increasing experience, that's proving less true. And now it seems that the ability for the virus to spread within households, especially multi-generational households or households that are, I'll use the word crammed in together in a smaller living space, that's very conducive to virus spread. We've learned that there's a lot of virus that comes to Vermont from the outside. And I'm not pointing fingers at people outside because sometimes it's identified because they're quarantining and then they get sick. It's not like they weren't obeying the rules, but they're coming from a higher prevalence region and into Vermont and identified when they're here. Or it's a Vermonter who's chosen to travel consciously to these places and conscientiously gets tested when they come back and proves to be positive. So we've learned that's an important mode of transmission as well. What we're not seeing, which knock on wood, is we're not seeing a lot of community transmission where we find some cases and all of a sudden we do some pop-ups and find that it's actually spreading through the population much more than we would have realized. So that's good news, but it's important to know that at this point in time. People who are living in this county know that we had a rather big outbreak in Winooski and some part of Burlington, but most of that was actually within a lot of households and in a community that was very socially connected with one another. And it actually didn't have broader implications for the immediate city or county itself. So we learned in that manner as well. Colleges are their own community, so this will be something new, very candidly. But even within a college community, it doesn't mean that because cases evolve and are identified, that they mean the whole community is affected. It may be a classroom. It may be a floor on a dormitory. It doesn't mean just because you've identified a case here, a case there, that you have widespread transmission throughout the community. And I do want to stress that because we have been very upfront with the state. As we reopen the state, we will see cases. We may see outbreaks, but we are at the point with our low level of numbers that we can contain every outbreak we find through the testing, isolating, contact tracing sequence. And that should be reassuring to people that case, at this point, nothing has blown up out of control. Everything has been containable using that strategy.
Thank you. One more, and then we'll go to Dr. Willens to hear about his experience at Mass General. Can you speak, Dr. Levine, about shared surfaces? We've been talking a lot during our faculty and staff sessions about how to keep classrooms clean and working with our custodial partners on their routines. But can you talk about shared surfaces, particularly we have a lot of computer labs when you're thinking about keyboards and other shared surfaces, what our expectations around cleaning should be?
Yeah, so those would be the ones I'd worry the most about, actually, things like keyboards. It would be nice if everyone had their own for every purpose they needed and didn't need to share one. I make this point emphatically that if you're fearful of contracting the virus, you're much better off worrying about, did I wear my mask and stay physically distanced, than did I actually touch something that might have been infectious. I do want people to wash their hands throughout the day, but at the same time, if they forget to do something, they should forget the washing the hands before they forget physically distancing or masking, because probably 90 to 95% are going to be through the air we breathe, 5 to 10% through the surfaces. If you're in that 5 to 10% who got it that way, though, it's very real to you, so I'm very aware of that. One can only clean buildings so often, so we have to sort of balance what we can do pragmatically with what we should do. But I would say that the things that are surfaces that people touch all the time, whether they be keyboards, whether they be doorknobs, those are the things that we should probably focus on the most. Not worry so much maybe about the chair we were sitting in or something else of that nature. So I hope that's helpful. And obviously carrying a small hand sanitizer with you, not for your hands, because you can wash your hands anytime, but to use on areas that you're at. Just like when you go into a supermarket, they often give you some sanitizer to use on the shopping cart. So you're pushing a shopping cart that you at least feel, I'm not going to get the virus from that because it's been sanitized. That's the kind of thing I want people to think about in their own life.
Thank you. You can't all see the other panelists, but Dr. Willens was nodding emphatically. I think so that'd be a great point to transition to him talking about working in a healthcare environment and sort of the precautions and routines that he and his colleagues have developed.
Thank you all.
Well, I want to thank Dr. Levine for just extraordinary work that they're doing in Vermont, and our DPH Commissioner Monica Burrell sends her best, and we really live by the work. You guys are really the heroes. You're out there and really putting yourself at risk in many ways because you're out in the field and off a lot, meeting with people and having these types of seminars. So thank you. And I'm going to come back to it, but I even brought a mask because I know that you state that, but some of the things that I'm going to come back to are lessons learned from Mass General, which is the biggest general hospital in New England, but also from work that we do. I work with the Director for Healthcare for the Homeless, and we have 150 beds that we maintain for detox care, et cetera, where we're not a general hospital. We don't have all this infection control. And we did pretty well, and lessons have been learned, and many of them you've just heard from Dr. Levine. First, I just wanted to start by saying, I got to start as a father. So 2 kids, why are we having this conversation? Because at least my kids are really ready to come back to school. They love Champlain. They love their faculty. They really want to go back to Champlain. And I got to tell you, as parents who have kids home now, who have been home for almost a half a year, I'm really ready for them to go back to school too. We're ready to break their necks at times because they've made it really easy for us to want them to go back. It's really important as a child and adolescent person, I can tell you it's very important for them to have that experience. I think every faculty member knows that. I don't need to go into that. You know more about that than I do. But the studies that are coming out now that are looking at that and the effects of not having school for kids are demonstrating that these kids are doing better in the school settings. And as Dr. Levine said, it's how do you do this safely? So what do you do to make this safe? So the bottom line is the experience from a hospital that just went through a surge. So as you know, Boston was in the middle of a surge. Our percent positive rates, by the way, are still in some communities running 12 to 14%. And again, just to give you the backdrop, you want to keep it below 5%, but Vermont, you said, is running below 1%. At the peak, we were running in the 15% across the state. We had 2/3 of our beds full with COVID. We have over 450 ICU beds that we built out to. 2/3 of them were with COVID patients. So you get the context that we had a lot of COVID around us, and there was a lot of COVID in the area. The punchline was when our healthcare professionals wore masks, okay, they wore their masks, they washed their hands, and they did as much social distancing as they could in the hospital setting. Plus, our patients wore masks. Everybody wearing masks. Our rates of COVID positivity in the face of a lot of COVID positive patients around was less than the community rates. We also found that in the 150 detox beds that we operate and step down beds, as well as the vast Boston Hospital, Boston Hope Hospital, which was 500 beds, and a whole network of healthcare for the homeless individuals who are in shelters, et cetera. The key was people wearing masks and everybody being vigilant about wearing your mask, social distancing, and hand washing. And again, I'm going to go back to, he's a commissioner of public health. So the things that we learned, and I'm a psychiatrist, but the things we learned for our divisions and for the hospital to stay safe, and for the people, all of the healthcare providers working in all of these ancillary things, prioritized was a mask on everybody across from you, a mask on you, keep distance, and wash your hands. We tried to keep surfaces clean. We did the best we can. And again, in both settings, I want to reassure people that the rates of the new cases, new incidents of COVID in our settings were below the rates in the general population. In other words, you were more likely to get COVID by going to Burger Biggie, and you shouldn't be doing that, or going to Costco or going to Kmart. That's where people were getting it. And also in these densely populated dwellings, which unfortunately there's many in the Boston area, and that is where it's aggregating. But outside of that, in the settings, our professionals, our healthcare workers, our frontline workers, and I agree with Dr. Akandi that educators are our new frontline workers, were safe by listening to what Dr. Levine said. The mask is really important. A couple other things I wanted just to comment on, and that became very important to us in the hospital in all of the settings we've been, having lived through this surge and having lower than community rates, much lower than community rates, very low rates of new COVID cases in people sitting across from patients with COVID and patients we don't know if they had COVID half the time, was that there has to be vigilance. So it's really tough. There's two levels of vigilance in yourself, and then you're sitting across from college students who arguably don't have their frontal lobes, or if they do, they're not fully developed yet. Number two, even if they come with great intention, and this is what's happening right now with young people, and it's 100% predictable by human nature, and that is that vigilance decays over time. Human behavior becomes one of the most important considerations when you look at over time, how do you keep people's behavior in check? So what I come to is it is going to be very important that as a community of educators, that people stay vigilant, that people across, that students need to be following the rules. Now they're going to start pretty well. They're going to do a pretty good job right up front, but it's going to decay. It just does, because that's human nature. And you're the ones who are going to have to, through designated authority from President Akande, everybody is a warrior in this. So when a kid comes in with their masks like this, or their mask like this on their arms, people, I see that around Boston with runners. That's really helpful, by the way, for COVID. When they're wearing it, they have to be reminded by the people sitting across, and everybody has to be part of this. By being part of it, it also helps to alleviate some of that anxiety that people develop by sitting with COVID and worrying, am I a passive recipient? No, you're an active participant in developing a community of improvement that keeps everybody vigilant. The other thing is you don't develop is hopelessness and helplessness. That is the beginning of sort of feeling trapped and depression. If you sit there and think, I'm coming into a room and I'm going to be hit and I'm worried because I have a pregnant wife at home, I've got a parent of mine that's immunocompromised because of cancer or something, then by being part of this and being part of this sort of community of improvement, which is what you see in healthcare settings, that you'll see that that will help everybody, because the students will be reminded and everybody will be reminding everybody. And the students ultimately need to be charged to do that with each other, although I think we all agree that's just not going to really happen at any extent. So I just want to, end my part by saying, as a parent, God bless you for opening the doors. I think the way you're doing it is very thoughtful. Boston, as you probably know, some institutions are full density. I've got news for you. Those institutions that are going full density are now rethinking because of the increased numbers in the Boston area. But there's a lot of institutions that have taken other courses, and Champlain seems to be a very reasonable thing. Number two, that as a healthcare provider myself, who does sit across and works in the general hospital these days, and worries about this and runs many beds in the community worrying about this, I have been comforted by the numbers that we're seeing, that when people wear masks, social distance, and wash their hands, that the COVID positive rate in that group is really very low. That again, it's probably a community acquired. So I think that I'm reassured. I think that working together and keeping the kids vigilant, which is an uphill battle, is going to help have what I think of as a very productive year.
Thank you, Dr. Willens. You're getting some shout outs in the Q&A about wanting to include some of your community of care language in some of our social media videos. That was a great and important message, and consistent with how we've been trying to think about that sense of shared responsibility. So if colleagues want to submit questions using that Q&A function at the bottom, I had a couple of other Vermont specific ones. Dr. Levine, why are high schools not testing students as colleges in Vermont are?
Yeah, so by definition almost, except for a few residential schools, high schools in Vermont are made up of Vermonters who continue to live in the communities that they've been living in, and presumably have the same risk of infection as anyone living in that community. So we don't feel they need to be uniquely tested because they're entering the school environment. However, we are doing a lot of messaging as we get closer to Labor Day, with the fact that, as I call it, a school is a microcosm of the community. And being a microcosm of the community, if people are being careless in the community and the disease rate is going up, it's going to be in the school too. Because who teaches in the school, who works custodially in the school, etc. So we're very concerned about that in that regard, that people might, with holidays coming, drop their guard a little bit or travel to places that frankly could be much more disease-ridden, if I could use that term, than Vermont would be. So we want them to be very careful. But we don't feel it's like a college environment where we have literally students coming from throughout the Northeast and Middle Atlantic regions, and then we have people flying in to Burlington. There's a very different risk level associated with those things than there are with a student who's been living in Vermont all along and now is just going from summer vacation to school.
Thank you. Dr. Levine, kind of related, can you just talk a little bit more about the day 0 and day 7 testing and sort of how the quarantine groups kind of map to that a little bit?
Yeah, so I mean, the day 0 is as soon as it could happen when the student arrives, which many campuses are actually making it literally as soon as the student arrives, which is great. You have to take into account some students are arriving to off-campus living, so there has to be very good communication about that. And the day 7 is just what it says. The students, you know, the quarantine situations are variable depending on where the student is. So the quarantine could be an entire campus. The quarantine can be a dormitory level quarantine. The quarantine can be a floor on a dormitory. The goal is to divide people into what we now term pods. And it's the same principle we've used in opening summer camps, where you have a defined but manageable number of students or campers in one location who only interact with one another and aren't interacting with the broader community at large. By doing that, should there be a positive case here or there, you know what pod it's in and who is at greatest risk and can manage it in that way, as opposed to having to manage a whole campus where who knows what's happening. I think Champlain, I can't remember the detail of what each campus in Vermont is doing, but I think Champlain is doing something very appropriate to the size of the school and the locations of where students are. But it's those principles in mind that are more important than the actual details, which you can get from the school.
Thank you. Dr. Willens, I'd like to go to you next. This is a question from a faculty member who notes your comments about frontal lobe development and is asking about being less concerned about student behavior in the classroom and more about what as a community we can do to influence behavior when students are beyond our reach.
Yeah, well, you get the Nobel Prize if you figure that one out, quite honestly. That's a tough one. It's a great question. What we're learning currently over the last 5 months of COVID is when we're very interested in behavior, exactly that kind of question. And there's been some presentations that now show that there's actually a lot more influence on downstream behaviors, exactly what you just, that's the terminology for what you're describing there, with upfront discussions and engagement of the individual. So just pontificating to a kid about not going to a bar, it will have little effect. Engaging the individual in the conversation so they understand the mechanism, the reasons, and the ultimate potential that their involvement at going to the bar could not only affect them, but it could affect other individuals and spread the virus. That has more of an influence, and that does have a downstream influence. They're finding more downstream influence than they initially thought. So and as a parent, I have to say, the faculty are divine to the kids. They worship you. They listen to you. They often correct their parents, by the way, on what their professor said, but that's a whole nother conversation. But they actually listen a lot to what you have to say, and your concerns become their concerns, and engaging them in that conversation. And again, reminding kids about this on a regular basis. You can't have this conversation once at the beginning of the semester and expect that it's going to carry. It is human behavior in these settings, especially with these kids, especially when they're going to have temptations, is like the second law of thermodynamics, entropy, decay rules. Things will decay over time. And that's what's going to happen with the behavior. So you're going to have these conversations over and over again. You're going to have to remind kids. You're going to have to ask them what's going on and engage them to help you understand what are kids now doing that they shouldn't be doing, and sort of get some reflection on that.
Thank you, Dr. Willens. Dr. Levine, is there anything you can say at this point about how the state is thinking about the spring semester and how the guidelines and practices we have in place now might apply once we get past the Christmas break?
Yeah, boy, that's so far in the future, isn't it?
I feel that way, but I know our faculty have done so much planning to shift how they're doing their courses, and they're already starting to think about those winter courses.
Yeah, no, I'm glad they're trying to focus on their work, and that's laudable. The bottom line is everybody decided pretty uniformly, and I believe Champlain's included, that classes end before Thanksgiving. And no one's decided, to my knowledge, the date people come back. So part of the planning has to do with where are we with vaccine development? Not that I'm being super crazy optimistic that, January and February, we're all getting our first dose of vaccine and life is good again, but there's a possibility, but, just to consider that. But more importantly, where are we with regard to the flu season? Because the thing that we fear in healthcare and public health the most is the confluence and convergence of flu season and COVID still present in our communities. Because obviously, we always have defined amount of illness from the flu, and sometimes that puts people in hospitals, et cetera, and stresses our healthcare system, even without COVID. And then you can imagine with COVID. So a lot is going to really be the consideration of how is that process going, and does it make sense for schools to open up when they might traditionally open up in the spring semester, or should they be waiting a little longer, or what have you. The peak flu season in Vermont is usually, it starts early, but the peak is usually in the March area, give or take weeks on either side of March. It all depends. Every year is different, and how intense the flu is and how well matched the vaccine is, and all that is different as well. So it's really hard to answer too many questions about the spring without knowing how the fall went in the first place, and then without knowing these other sort of futuristic things I've just put up here that will really be significant considerations for everybody. That's really all I can say. I'm going to be vague because it wouldn't do any good to just sort of come up here and say something that would make people think I really could see the future that well and tell them exactly what to do. I have to be honest.
Well, I'm grateful for that answer as a person that answers a lot of questions here about Champlain's plans. That is the approach we've taken with students and families, that anything we say now about the spring would just be a guess, and that it wouldn't be honest, and having to take something back actually might be harder than the uncertainty. So I'm happy that that is your professional approach too. Can you speak a little bit about ventilation concerns or considerations? Not all of our faculty and staff have offices with operable windows, and how should we be thinking about airflow?
Yeah, so if there's one thing that big institutions like universities know how to do, it's to assess their ventilation. I know in state government, every state office building has had its systems assessed, and people are focusing on that in our Buildings and Ground Services division. So we feel a sense of comfort and confidence in that. I would think, without knowing the specifics of Champlain, that same exact process is going through right now. I still think that the principle of holding classes outside, using the good weather for as long as you can milk it, is a good thing. And if the class size is amenable, and the locations are amenable, getting out of the buildings is always a good move, for sure. When it comes to a specific office, again, if the ventilation system of the building has been assessed and people are comfortable with it, I would definitely go with that, because you can filter out a lot of stuff. Specifically, virus can be filtered out and certainly diluted out in a great way. It's a shame nobody's guaranteed an office with a window, and I sympathize with that. But at the same time, one can sort of budget the time they're using in the office. And if, depending on their classroom time, obviously there can be times they just take their work home if they're not obligated to be on campus for a certain period of time. Whatever they can do to make themselves feel more comfortable, knowing that the university at least is taking care of the larger scheme of HVAC systems and what have you.
Thank you. There was a question about holding class outside and use of masks in that context.
Yeah, so the way the mask guideline is written is, mask indoors for sure and outdoors when you're unable to physically distance. So I would kind of use that rule, the physically distance, but I don't see a lot of harm in the students and the faculty wearing a mask if they're outside. Keep in mind that there's greater chance for transmission of virus from singing and speaking and yelling than there is from just breathing. Not that breathing is safe, but those are worse. So if the faculty is, of course, facing the students, and the students are facing the faculty, I would think they would want to have masks on. It's much different when you're in a classroom and all the students are facing the same direction. For them, that's better for them, but it's not so good for the person on the other end and vice versa. So masking is something that, when you're around people, you should do. When I go for a run, I'm not wearing a mask, but I have it with me in case I'm in a place where I suddenly have a bunch of people around me and we're talking or whatever. And I think it's just something that you should subconsciously always be in the mode of putting on because you're near people, as opposed to looking for ways to avoid putting it on.
Thank you. I think we have time for one more question. I'd like to go to Dr. Willens, and then I'll come back to President Akande for any closing thoughts. Dr. Willens, as you know, in our flex hybrid model, we will have faculty that are teaching virtually and in the classroom, and students that are also in both locations. What advice do you have for faculty to help keep them engaged with their students to support their health and safety if they're separated in that way?
Yeah, that's a great question, and I think each time you're talking to them, to ask and remind them about the safety considerations that you've discussed, to remind them that they're part of a community. I think you're going to be, challenged. I think the faculty are phenomenal faculty. I think Champlain has among the best faculty in terms of engaging kids in the country. And then the question is, how do you engage them virtually when you're doing these remotes? And then how do you keep them engaged and also self-care around COVID? Self-care, I think Champlain has led the country in terms of well-being of kids, and that's an initiative and something that we're working on with you. But in addition to that, with that well-being now is well-being around COVID and health for them. And if they're, depending where they are, if they're home, safety for their parents and how to maintain safety for their parents. So I think it's going to be an ongoing conversation. I think it's going to be questions and interactive. And I think it's also going to be, Dr. Levine said this, and part of the issue we deal with COVID is that there's a bit of shifting sands on COVID. What sort of is fact yesterday is not fact today. So it shifts, it changes. And I think that everybody's going to have to be updated. And I think, updates from the college, updates from the Department of Public Health in Vermont. You may not have read those before, but you've got to read those now. One thing we learned, again, lessons learned from Mass General was it didn't matter what kind of physician you were, what staff you were all expected to know about COVID. It was an absolute understanding that everybody had to know about COVID, and every broadcast that came through, everybody needed to know. I think that was really good because everybody got booted up on it. And I would advise people to be that way and then disseminate that information to the students.
Thanks, Dr. Willens. President Akande, did you have any closing thoughts?
Yes, I do. I want to thank our two guests tonight, Dr. Wellens and Dr. Levine. We truly appreciate the fact that you've taken time to come in and take the questions and re-engage us. In closing, I want to say that as we prepare for this return to the fall, our focus is really very simple: safe, welfare, and care. And as we move forward, we will continue to stay engaged with our medical practitioners and seek their counsel. We will be operating in real time and be able to provide information to our faculty members and staff as they engage our students. I just want to thank everybody for taking a few minutes out of your Thursday evening to visit with us. We'll stay in touch, and we ask for you to do the same thing too. Again, thank you so much, and we'll see you soon. Bye-bye.